So one of the ways to know is from our symptoms. The other way to know is from measuring. So symptoms are pretty simple to know. Measuring takes a little bit more of a doctor's involvement, and there is something called a 4-point cortisol test. So when we are under a lot of stress, a bunch of different systems get involved. And one of the major systems that gets involved is our hormones. And our adrenal glands put out the stress hormone cortisol when you're under high levels of stress. So actually measuring cortisol is one of the most direct measurements to know if you're stressed and what level of stress you're in and where on the continuum of stress you're at. So we're going to talk about that for just a minute. This is a 4-point cortisol test, and it's a normal result. You can see that these measurements are taken morning, noon, mid-afternoon, and evening. And you should be in this nice green line here in the middle. And that means you're going to have a ability to get up in the morning and be a morning person and have some energy, have sustained energy throughout the day. And at nighttime, when you're supposed to go to sleep before 10 p.m., you start to get sleepy and you can fall asleep by 10 p.m. That's a normal cortisol measurement. So when your body gets under a tremendous load of stress, your cortisol raises. It's the first thing. It actually increases your heart rate, increases your blood pressure in most instances, and also increases your adrenaline, which is a hormone that comes from your brain. And in the first phase, usually you're going to spike your cortisol really high and make it so that you can't sleep at nighttime very well. You might wake up in the middle of the night with racing thoughts, or you can't get to sleep, and then you kind of have a hard time waking up in the morning to get going. And if that stressor goes away, so say for instance, you are walking down the street and a pit bull starts to run and chase you, barking as loud as it can, and it starts to go into attack mode, your cortisol can raise really high. And it can come down pretty fast too, if that's what it's designed to do. But if you're under a long-term stressor, like a work stressor or a life stressor or a world stressor, where the stress is prolonged for a long period of time, your body continues to emit cortisol and keep that level high. And what will happen in the test is that you'll start to crash in the mid-afternoon. You'll need coffee or some kind of caffeine or some kind of sugar, something to keep your body moving, but you're still not going to sleep very well at nighttime. You're still up in that range. And then if the stress goes on for a longer period of time, you don't necessarily stay up all night, but you can't get moving throughout the day. And that level gets more and more fatigued till the point that you go into extreme fatigue, cortisol fatigue or adrenal fatigue, where you're still pushing all the stressors. And you may still have a long-term effect of elevated blood sugar, which is very common with cortisol rising. Your blood sugar also rises, or elevated blood pressure, but you're exhausted. It's hard for you to exercise. It's hard for you to get moving, and your gas tank is empty because all of the nutrition, all of the supply that helps your body make cortisol to sustain that stress response is actually gone. So your body's still under stress and still dealing with the effects of it, but it can't make the cortisol to keep you up. So you crash. And I have seen some people in this last stage, and it's a very hard place to recover from. So my goal tonight to say is to see if you recognize yourself in some of that. Please, please take to heart that we don't want you to come down this continuum and end up here, because it's a hard place to recover from.